I want to thank the YouTube company and the YouTube as one of the important social media, because this is the first video to be live according to their regulations and their procedures for any YouTuber to become or to broadcast live after reaching the 50 subscribers. And they already reached this number and exceeded, so they allowed me to be live, same like before. ففيرست اوف اول بسم الله الرحمن الرحيم، اشكر ربنا سبحانه وتعالى والحمد لله رب العالمين على توفيقه ليا بالوصول لهذا العدد من السبسكرايبرز. وانا يوتيوبر من سنه 2014، يعني almost 10 years. But there was some period of time interrupted because they first allowed me to be live, and then because of the few number of subscribers, they had regulations which didn't allow those who had less than 50 subscribers to broadcast live. So I was not be able to broadcast and present live. But this year, I already reached to their ceiling and the number allowed, and fulfill the conditions and the circumstances of YouTube to broadcast live. فالحمد لله رب العالمين، نشكر ربنا الأول سبحانه وتعالى على توفيقه، نشكر اليوتيوب، ونبدأ في رحلتنا في النيو لايفز إن شاء الله. This is Professor Dr. Tarek Ali. Thanks to first my gratitude to the Lord, Allah subhanahu wa ta'ala, and then to the YouTube, and then to my supporters and to my fans and friends and colleagues who are following me every time and everywhere, and who are waiting for me to broadcast live بإذن الله سبحانه وتعالى، توفيقه سبحانه وتعالى إن شاء الله. We will have to start our new journey according to God's will, and to continue broadcasting my live videos in different fields, in clinical medicine, in the medical law, in the philosophy of medicine, and in the links between medicine, philosophy, and law, as well as also broadcasting some videos related to topics, different topics in the philosophy of religion and the points of importance in Islamic Quran and in the Quranic sciences, since I have insights and thoughts about the holy book, the Quran, and about the philosophy of the fiqh and the philosophy of religion, namely Islam. So this is the, but let me focus more on clinical medicine, being my pivotal and original and long-standing profession for a long time, since I was in my early years of life as a doctor, as a physician, as a clinician. So the videos related to my medical profession and as a medical expert and as a health care professional and as a healthcare provider will be more. and I will focus on these fields more. The field of healthcare and the field of being a medical expert and being a senior consultant physician and as a professional medical practitioner and as a formerly professor of internal medicine at Cairo University and a staff member in Faculty of Medicine, Cairo University, Qasr Al Aini, for a long time, almost 21 years before I leave Egypt, and then I become more widespread regionally in the Middle East and internationally in medical conferences, as God's will and God's want to me. So this is in short the video. The purpose of the video was to show my gratitude to Allah subhanahu wa ta'ala, number one, for guiding me and helping me, and then to the, as I mentioned, to the YouTube and to my fans and colleagues and friends who are my subscribers or who are subscribers to my YouTube channel, who helped me to reach the limit allowed by the YouTube to start to live broadcasting. Thank you so much. And my next live will be about the challenges or the modern challenges or the new challenges, which I see them in modern clinical practice. That is clinical practice in this era, in the new era, in the third decade of the 2000s, of the 2021 century. We are now in the third decade. We are 2023, and we are approaching this 2023, about to reach to its end after a few days, and then we start a new year of 2024. And by this occasion, I want to send my gratitude and my greetings to my friends and my fans and my colleagues everywhere. That is festive greetings for the new year 2024. So happy new year before it comes soon after almost 15 days now. Thank you so much. And I wanted that every one of you focus and be aware and be cautious and be careful, especially my colleagues and my friends in the medical profession and who are working as healthcare providers, because we are now in a new era, different from the era before 10 years more and 20 years and 30 years. The clinical practice has changed due to the emergence of the artificial intelligence now and the implementation of high tech or high technology in the diagnostic process, as well as in the therapeutic process in the pharmaceutical industry, as we all know, and the recent advances in the therapeutic industry and in the pharmaceuticals and pharmaceutical industry related to the production of new agents which help to treat and fight the diseases which we treat them as, and we see them and we diagnose them as doctors or as healthcare professionals or healthcare providers treating patients. The high technology helped in better diagnostic tools, the evolution of better diagnostic tools, helping the healthcare provider, whether physicians or surgeons, to reach to diagnosis, and also the high technology in the manufacture of drugs and therapeutic agents, which help to treat disease, as well as, of course, in the other biomedics, which are used in post treatment and in post diagnosis and first and then treatment of patients. So this high technology. But in spite of the high technology and high tech and its role in the updating the diagnostic tools and updating the therapeutic tools, we still meet what we call clinical challenges in clinical practice, which, in spite of these advances in diagnosis and in therapeutic options and in therapeutic modalities, whether drugs or non-drugs, we still meet difficulties in clinical practice. We still meet difficulties as health carers or as doctors in clinical diagnosis and in clinical management or treatment of the cases. And still, the outlook of the patients in many diseases is not as expected or is not as wanted for our patients to be in or to arrive to. There is still medical clinical challenges because of many things, because of business, because of money, because of circumstances of the clinical settings, whether in the primary care or in the secondary care or in the tertiary care, the pressures on the doctors, the environment and the atmosphere in which the doctors are working in the different categories of healthcare practice foundations, whether hospitals or clinics or medical centers, the doctors still facing problems and challenges in clinical management of patients, affecting both diagnosis or the diagnostic process and consequently affecting the therapeutic process. Because if there is no diagnosis, there is no treatment or therapy, proper therapy given or designed to be given to the individual coming to the healthcare practitioner, or what we call the healthcare consumer, which is the patient. Because we have healthcare consumer, the patient, and we have healthcare provider, the physician or the surgeon. Still, we have many clinical challenges. Still, we have difficulties. The outcome is not affected too much by these advances in many diseases. Still, the mortality, the morbidity is high. The mortality is high in many diseases, both in acute medicine, that is, in medical emergencies or urgencies, and or in chronic or cold medicine as well. That is practice in both the emergency rooms and in the outpatient clinics, in acute diseases and in chronic diseases, or in acute on chronic conditions. So, what are the causes of these challenges? I will talk about them in my next live broadcasting, inshallah. Thank you so much. And again, I thank my colleagues and my friends and my fans for their support and giving attention to me. And let us continue our efforts to help us to be a better healthcare providers, helping the community and helping the society and helping the patients, which is the center of the healthcare profession, our patients, individuals who are suffering from problems in their health, whether physical or the mental, or both the physical and mental health, with its repercussions on the social status of our patients or our individuals. because as we all know that health is a state of a good physical, mental, and social well-being, the simple definition of health. So, how can we improve ourselves as healthcare providers to help our patients and to improve the health status of and to treat our healthcare consumers who are coming with physical or mental or social problems. That is a biological problem or social problem or biosocial disorders, diseases. Thank you so much, and let us meet in my next live broadcasting.